All right, we'll do the first mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. All right, we'll do our final mic check. 1, 2, 3, 4, 5. And over here for questions. 1, 2, 3, 4, 5. We'll get started in about 5 minutes.
Good Thursday afternoon. I'm Dr. Martha Buchanan, a Director and Health Officer here at the Knox County Health Department. In honor of Colorectal Cancer Awareness Month, our moment of gratitude is dedicated to those who are prioritizing their health by continuing to get their regular health screenings. We want to encourage everyone to talk to their medical providers to ensure you are maintaining your regular appointments and checkups. We also want to thank the medical providers across our community who are helping folks recognize the importance of staying informed about their health. I'll begin today with a vaccine update. As of Friday, we are vaccinating folks at the Broadway site. We're very excited about that. I'm pleased to be able to, pleased with how everything has gone so far. And we're able to move people through, and people are very happy about the flow, and our staff is happy to have a location to go to on a regular basis. As we've stated before, this base gives us the ability to offer vaccines in a regular manner at a consistent location. Right now, we are vaccinating anywhere from 400 to 500 people a day with first doses, with plans in the near future to increase to 800 to 1,000 a day that will include both first and second doses. Because of the incredible partnerships between public health, hospitals, and medical providers across our community, more than 148,000 vaccinations have been reported among Knox County residents. More than 20% of people having at least some level of protection against COVID-19. This is great news and something we will continue to build upon. As of this week, we are updating those vaccination numbers on our website daily, Monday through Friday. We're getting to the place where the supply of vaccines is increasing, which is improving access. And this is a good thing. That said, we know there are still many folks in the community who are eligible to receive the vaccine, but have not yet been able to. We continue to encourage those folks to look at all of the opportunities across our area, whether that's at hospitals, pharmacies, health departments, or medical providers' offices. Our vaccination strategy from the beginning has been a community strategy. We believe the best thing for the public is to have multiple access points for vaccination. That's why it's important that this is not just the health department, that's not just us, the health department, providing vaccine. And we are grateful to the providers in our community who continue to push out vaccine as quickly and efficiently as resources allow. Now moving on to the local situation. We have 71 new confirmed cases since yesterday. 860 active cases. This is the lowest number of active cases we've seen in a very long time. This is incredibly encouraging news and something we hope to continue to see. 33 Knox County residents are currently hospitalized, and sadly, we have 2 additional deaths to report, raising our total to 598. And now we'll turn to the benchmarks. As a reminder, all of our benchmark data is available on our website. You can find it at covid.knoxcountytn.gov/case-count. The first benchmark, sustained reduction or stability in new cases for 14 days. Since mid-February, you can see a downward trend of new COVID-19 cases that has plateaued in recent weeks. For the past several weeks, this benchmark has continued to be represented as green due to the lower volume of new COVID cases across our community. Over the past 2 weeks, we've seen a daily new case drop to approximately 56 cases per day, which is consistent with previous reporting periods. It's important to note we are seeing these figures leveling off to more of a plateau. We want to see these numbers decrease and not level off. So we continue to urge folks to practice the 5 core actions and get vaccinated when you are able to reduce the spread of disease in our community. The leveling off doesn't mean COVID's gone. COVID's very much still in our community. And because of all these factors, we are representing this benchmark as green. Second benchmark, community-wide sustained and increased diagnostic testing with consistent or decreased test result reporting turnaround time. Regarding lab turnaround time, this figure has been pretty consistent over the past month at less than 2 days for the community. For this reporting period, we are sitting at under day and a half of turnaround time. Regarding testing, we continue to see low numbers, but they have remained relatively consistent. In the past week, there were 4,800 tests conducted across the community, which is 200 more than last week. We're hopeful that the decrease in testing in recent months is an indication of a lower burden disease across our community. But we will continue to keep a close eye on this metric. Because of these factors, we are representing this benchmark as yellow. Our third benchmark, sustained or increased public health capability. The goal is to increase vaccine distribution across the county. From mid-February to early March, you can see that we were pretty consistent at about 15,000 vaccinations provided across the county. During the past week, we saw that number jump up to more than 21,000 vaccinations. This is a big jump and extremely encouraging. As you can see, we are trending in the right direction, but we recognize that not every provider who wants vaccine is able to receive it. While supply is increasing and access is improving, it's not quite where we want it to be yet. For these reasons, we are continuing to represent this benchmark as yellow. Fourth benchmark, healthcare systems capabilities remain within current and forecasted surge capacity. Over the past month, we have continued to see the number of hospitalized COVID patients decrease. It has been a relatively steady decrease with a bit of a plateau in the most recent days. After speaking with our hospital partners, they have recommended that the benchmark continue to be represented as green. Fifth benchmark, sustained or decreased COVID-19 related death rate for identified positive or probable cases. Over the past month, the number of deaths has decreased. Back in February, we were seeing an average of 2.5 deaths per day. In the past 7 days, we've seen an average of less than 1 death per day. While this is encouraging, we want to see this continue to trend down and not plateau. According to the White House report, Knox County and Tennessee as a whole are still yellow for deaths related to COVID. This information leads us to represent this benchmark as yellow. Under our supplemental data section, the first chart shows new daily COVID cases per 100,000 population. As of yesterday, our 14-day trend line shows 12 new cases per 100,000. And our 7-day trend line shows 10 new cases per 100,000, both of which are relatively consistent with the last week. The second chart shows the percent positive for COVID-19. This data is received from the Tennessee Department of Health. The 7-day average for percent positive in Knox County on Monday was 7.86%, which is slightly down from last week. And now I'll open it up for questions.
All right, as a reminder for our media colleagues, go ahead and submit your questions into the chat feature. From Brian Hornback, do you have availability information among the other partner providers on the 1-dose Johnson & Johnson in Knox County?
We don't have information on who's getting what vaccine. You'd have to reach out to those individual providers to know what they're getting.
From Tanya with WBIR, we understand that many people are not removing themselves from the KCHD waiting list when they're able to get a vaccine elsewhere. What is the best way for people to remove themselves from the list?
That's a great question. The best way to remove yourself from the list is to call 215-5555 and ask to be removed from the list. Or you can call 215-5555, sorry, I'm being corrected in the room.
All right, and that is our public information line, Tanya, and the folks on that line can assist anybody in removing themselves. Any further questions? Please go ahead and submit them. From Will with WBLT, what is the recommendation to people about going to larger gatherings as more and more events open?
Still got to follow the 5 core actions. You need to maintain social distancing away from people who are not in your household. Wear your face mask. Wash your hands regularly. Absolutely do not attend anything if you're sick or feeling badly. And continue to follow the 5 core actions. Get vaccinated when you can, but you still have to follow the 5 core actions after you get vaccinated.
From Tanya with WBIR, how many people are currently on the waiting list?
I don't have that number. We can get back to you because I'm sorry, I don't have that number in my head.
We can get back to you. It is constantly a moving target, so we can provide that information to you, Tanya. From Vincent with Knox News, last night the Board of Health brought event spaces under the restaurant rules. Can you clarify what kinds of businesses fall under event spaces?
That's a determination made by the business. It's not, we don't make that determination. People who provide space to have an event in would be an event space or a venue.
From Will with WVLT, can you clear up efficacy with Johnson & Johnson shots? What does 68% mean?
Sure. So the Johnson & Johnson vaccine, which is a one-dose vaccine, is a very effective vaccine. It is effective, about 60-70% effective in preventing disease, but it's 100% effective in preventing severe disease or hospitalization. So it is a very effective vaccine. If you compare that to flu vaccine, which is in the 40 to 60% range, it's an effective vaccine.
From Austin with WATE, how much longer would you recommend keeping a curfew/mask mandate? Do you think we are on track to dropping both in the next few months?
So curfew/mask mandate are different things. It totally depends on the numbers. You heard the Board of Health last night. It depends on the Board of Health. Depends on whether people continue to follow the 5 core actions. We continue to see our numbers go down, or if our numbers go back up, we may have to reconsider things. So it totally depends on our community and what they choose to do with the 5 core actions.
From Allie with Knox News, is the Knox County Health Department considering a change to its standby list? And is this list still just for those who are currently eligible?
I'm not aware that we're considering a change with our standby list. And yes, the list is only for those who are currently eligible within the phase, which honestly is a whole lot of people right now. Anybody over the age of 18 with a chronic medical condition, that includes a lot of people in our community.
From Will with WVLT, do folks need driver's licenses when they show up to get shots? And how are you making sure people are in qualified phases?
We are trusting people to be honest. We were early on asking for employer identification because it really was employee-based. Those phases were employee-based. But now that we've moved out beyond that, we're really not asking for that. I believe they have to fill out paperwork and fill out their date of birth and stuff like that when they're there. But we're not asking for any documentation or proof that they are the age they are, or that they are have a chronic illness or anything else. Obviously, we don't want to vaccinate people who are too young. So the vaccines that we have right now, Moderna is able to be given to people who are over 18, as well as Johnson & Johnson. Pfizer is the only vaccine that's available for people 16 or 17 years old who qualify. So we don't want to give it to somebody who's too young. But again, we're asking people to write down their date of birth for us and to be honest.
Allie with Knox News asks, is there a phone number people should be looking for if they're waiting on a call about their appointment? And I can answer that one. We're still looking into that, Allie, to see if it's one number or a couple numbers that is coming out to. So we're checking with our team and our IT team as well to see what that looks like, and we can get back to you. From Brian Hornback, do you recommend the vaccinefinder.org website to persons that are looking for vaccine appointment availability?
Absolutely. That is the most complete list of places where you can get a vaccine across the state and in the county. It includes the pharmacies have been activated through the federal partnership, as well as pharmacies have been activated through the state. So it is the most complete list.
Any further questions? Please go ahead and submit them now. From Vincent with Knox News, just to be totally clear, the current recommendations for events are to wear a mask and keep physically distant, correct?
Yes, read the restaurant recommendations and also read the Tennessee Pledge. The regulations don't negate the Tennessee Pledge. The Tennessee Pledge has a lot of really good guidance for venues and people operating them about keeping household units physically distant. We continue to recommend that. Read all of our recommendations. They recommend 6 feet of social distancing from people who are not in your household.
From Brian Hornback, he's saying, just as an FYI, many of the county office phone numbers appear as spam on cell phones.
We're aware of that. Thank you.
All right, any further questions? From Vincent with Knox News, is the health department prepared to contact trace from events that was talked about last night?
Yes, we are.
All right, and any further questions trickling in? All right, I'm not seeing any other questions come in today, so thank you all for your time. We hope you have a good rest of your day and a safe weekend as well.